So cold plunge is a type of cold therapy. When you look at the research does not really specify that it is going in a body of water. It is cold exposure. And what happens when you get this cold exposure is your body is learning to adapt to temperatures. You are having a moment where your shiver reflex happens, and this turns on the brown fat, which is a really good fat. Now, cold plunge, if you put your face in the water, also turns on a diver's reflex. Now, if I get really specific and talk about cold exposure, cold therapy, ice bath plunge, there isn't really research very specific to females, except there is one study with Korean divers, and they were doing deep ocean diving, which I feel that I cannot apply that to the masses. That is a very specific population. But as a former athletic trainer, we do know that cold therapy is very helpful for reducing inflammation. For instance, when I was an athlete in college, after I ran cross country, I would go into an ice bath, 57 degrees, stand in it for 20 minutes while studying and doing my homework. With the ice baths and cold plunges, the therapeutic range is somewhere between 40 and 60 degrees, 57. So I would not get in my ice bath before it's 57 degrees because it's really warm. My preferred cold plunge temperature is 52 degrees, and I can do 3 to 6 minutes, and I do that 3 times a week. There has been research to show that doing cold plunge for 11 minutes a week is helpful. But in that time period, you need to be cold and get that shiver reflex, which turns on the brown fat. I am doing cold plunge personally because I am perimenopausal, and my brain fog and joint pain was getting to be so severe it was bothering me. I am a physical therapist. I do manual therapy. I am known for these things, and if my body hurts and my brain is foggy, I can't be the best version of me. So I started doing cold plunge, and what was crazy is this. I feel relief for 3 hours. 3 hours after a 3 to 6 minute cold plunge. Less joint pain, less brain fog. I feel clear and I feel good. It is no joke. It is real enough that I will hurl my body into a cold tank in the morning. Now, I didn't just go straight to cold plunge. I had been trying cold showers for a while. Cold showers are good. If you can make yourself shiver, and then if you're in the shower and you're shivering and you're cold, can you control your breath? That is really what it all gets down to. So I'm technically doing the cold plunge because I want my joints to not hurt and I want my brains to not feel foggy. And I get that. I feel much better. But it is also about controlling your breath and regulating your nervous system, which getting your sympathetic and parasympathetic and getting that all on track. So if you do a cold shower, an example is you make it cold enough that you feel so cold that you feel uncomfortable and you shiver. And then while you are shivering, sing, hum, breathe, be controlled, because that is the whole idea of cold exposure. Now, the cold plunge, some people plunge at a very, very cold temperature. I don't want to do anything that is unsafe, that I would hurt myself and die. I am staying safe at 52, and I will assure you, I will make it colder if I feel like I acclimate to that, so that I do get that shiver. And some days I can tolerate it better than others. And once I have got that cold shake, I am trying to control my breath, my heart rate's going down, and 3 minutes later, maybe 6, I hop on out, and I do that 3 times a week, and I really, truly feel drastically better. So that's why I do it.